Hello, everyone. Hello, everybody, and welcome back to another episode of the Average Joseph podcast. Before I begin, I want to be completely transparent with you as always. My name is Joseph, and I'm a certified social worker with experience supporting individuals and families navigating neurodiversity. However, I'm not a medical doctor, psychologist, or licensed diagnostic clinician. Everything presented in today's episode is compiled entirely from publicly available reputable sources, including the latest reports from the Centers of Disease Control and Prevention, the DSM-5-TR Diagnostic Manual, peer-reviewed research summaries from major health institutions, and guidelines from autistic-led organizations. This content is created purely for educational and informational purposes. It is not medical advice, nor is it a substitute for professional evaluation, diagnosis, or treatment. If you or a loved one have concerns about autism spectrum disorder, ADHD, or any developmental or mental health matters, please consult a qualified healthcare provider, developmental pediatrician, or licensed specialist for personalized guidance. With that important clarity out of the way, thank you for joining me. Let's begin our comprehensive, respectful, and in-depth exploration of AuDHD. Today we're going deep into AuDHD, the common experience of having both autism spectrum disorder and ADHD at the same time. This isn't a quick overview. We'll cover the history, how the two conditions interact, sometimes in contradictory ways, the full diagnostic picture, signs across every life stage, the latest 2025 prevalence data, causes, myths, incredible strengths, diagnosis challenges, especially for adults and women, neurodiversity affirming supports, workplace and school accommodations, and practical ways to thrive. Whether you're an adult who's just realized this explains everything, a parent, educator, partner, or colleague, this episode is for you. We'll center autistic and ADHD voices, honor the neurodiversity movement, and focus on acceptance rather than fixing. So grab a notebook as always. There's a lot of ground to cover. The story of AuDHD really begins in 2013 with the DSM-5. Before that, you couldn't officially receive both an autism and ADHD diagnosis at the same time. The manual said one excluded the other. That changed when researchers recognized how often the two co-occur. Autism was formally described in the 90s by Leo Kanner and Hans Asperger. ADHD, originally hyperkinetic reaction, dates back even earlier. But it wasn't until large-scale studies in the 2000s that we learned 50 to 70% of autistic people also meet criteria for ADHD, and 20 to 50% of people with ADHD show significant autistic traits. By 2025, the term AuDHD, coined in neurodivergent communities, has exploded in awareness, especially on social media and in adult self-discovery. It's not an official diagnosis. You'll still get two separate ones, but it perfectly captures the unique lived experience. This recognition has led to better screening and more affirming care. AuDHD simply means having both autism spectrum disorder and ADHD. These are two separate neurodevelopmental conditions that frequently travel together because they share some genetic roots and brain wiring differences. Autism involves differences in social communication, sensory processing, and a preference for predictability and deep interests. ADHD involves differences in attention regulation, impulse control, and activity levels. The brain's interest-based nervous system that craves novelty and stimulation. When combined, the traits just don't add up. They interact, sometimes clashing dramatically. An autistic need for routine can battle an ADHD craving for new experiences. This creates a unique internal experience that feels like your brain is pulling you in opposite directions at once. Since AuDHD means meeting criteria for both, let's review them clearly. Autism spectrum disorder from the DSM-5-TR. Persistent deficits in social communication interactions, plus at least two restricted/repetitive patterns as detailed in my previous autism episode. Support levels 1, 2, 3 apply. ADHD, as in the DSM-5-TR, at least 6 symptoms, 5 if age 17 and up, of inattention and or hyperactivity, impulsivity that are inconsistent with developmental level, present before age 12, occur in 2 or more settings and cause significant impairment. The 3 presentations, predominantly inattentive, predominantly hyperactive, impulsive, or combined. In AuDHD, clinicians note specifiers for both and how they interact. The key change in 2013 allowing dual diagnosis was groundbreaking. Diagnosis now often includes tools like the ADHD for autism and DIVA-5 or Connor scales for ADHD. plus neurodevelopmental history, signs, symptoms, and how autism plus ADHD interact across the lifespan. This is where AuDHD gets fascinating and exhausting. The traits often mask each other, leading to late or missed diagnosis, starting with early childhood. Autism signs, such as limited eye contact and repetitive play, might be overshadowed by ADHD hyperactivity, or vice versa. Intense focus on trains, autistic special interests, looks like ADHD hyperfocus. Sensory overload plus impulsivity can mean meltdowns that look like bad behavior. Next, we have school age. The classic AuDHD clash appears. You crave routine but get bored easily. Homework, impossible without interest, yet you hyperfocus for 8 hours on a video game. Socially, autistic social exhaustion meets ADHD impulsivity. Many kids get diagnosed with one condition first, the other emerges later. Moving into adolescence and adulthood, burnout is extreme because you're constantly fighting internal contradictions. Rejection sensitive dysphoria plus autistic shutdown equals emotional roller coasters. Executive dysfunction is amplified. Starting tasks is hard, and changing plans feels impossible. Many adults describe autistic burnout meets ADHD paralysis. Sensory issues plus restlessness. Sensory plus restlessness equals pacing and noise-canceling headphones. Common AuDHD experiences include hyperfocus on special interests but zero attention for boring tasks. Need for sameness yet constant craving for novelty. Deep empathy but emotional dysregulation. Stimming that looks like fidgeting. Variability, co-occurring conditions, and the spectrum. Support needs in AuDHD vary wildly. Some live independently with accommodations, others need substantial daily support. Co-occurring conditions are often even more common. Anxiety, depression, sleep issues, gastrointestinal problems, and sensory processing disorder. ADHD medication response can be different in autistic people. Some thrives, others experience increased sensory sensitivity. According to the CDC's 2025 ADDM Network Report on 2022 data, autism is identified in about 1 in 31 8-year-old children. ADHD affects roughly 11.4% of U.S. children aged 3 to 17. Comorbidity is high. Research consistently shows 50 to 70% of autistic individuals also meet criteria for ADHD. In autistic adults enrolled in Medicaid, ADHD rates are 10 times higher than the general population. Among adults with ADHD, up to 45% show significant autistic traits. Rates are rising with better awareness, especially in girls, women, and people of color who were historically underdiagnosed. Causes, risks, and the science. There's no single cause. Both conditions have strong genetic components with overlapping genes. Environmental factors such as prenatal, birth complications, older parental age play roles. Brain imaging shows differences in attention networks and sensory processing. Myths busted. Myth 1, you can't have both. This has been false since 2013. Myth 2, it's just bad parenting or laziness. Again, this is false. Myth 3, people can't succeed. This is completely wrong. Many brilliant innovators have AuDHD traits. Myth 4, medication will cure it. Medications manage symptoms. Acceptance plus accommodations are lifelong tools. Strengths, talents, and the neurodiversity movement. AuDHD brains are powerful. You get autism's deep pattern recognition and special interests, plus ADHD's creativity, hyperfocus energy, and out-of-the-box thinking. Many describe superpower mode when interests align. Famous and self-identified AuDHD voices include innovators, artists, and advocates who credit their dual wiring for unique perspectives. The neurodiversity movement reminds us these are natural variations, not deficits. Nothing about us without us. Diagnosis, process, and challenges. Diagnosis often requires separate evaluations or a skilled clinician experienced in both. Adults frequently self-identify after burnout or when a child is diagnosed. Tools include developmental history, observations, and ruling out other conditions. Late diagnosis, especially in women, is common because traits mask each other perfectly. Supports, interventions, and accommodations. Neurodiversity affirming approaches are key. Honor stimming, use special interests as motivators, respect routines while building ADHD-friendly flexibility. Early interventions for kids, for adults, ADHD medication when appropriate, therapy, CBT adapted for neurodivergence, not compliance focused, occupational therapy for sensory needs, schoolwork accommodations, flexible deadlines and interest based tasks, noise canceling headphones plus fidget tools, written instructions plus advance notice of changes, quiet spaces and movement breaks, mentorship and neurodiversity hiring programs. Many companies now actively recruit AuDHD talent for innovation. How to be a better ally, some practical tips. Ask, how can I support you instead of assuming? Respect both routines and need for novelty. Celebrate hyper-focus without judgment. Give processing time and literal communication. Advocate for sensory-friendly and flexible environments. Amplify AuDHD voices. Resources and further learning, to include the resources used for this episode. CDC Autism and ADHD pages. Autistic Self-Advocacy Network. Children and Adults with ADHD, CHADD. Attitude Magazine. Excellent AuDHD articles. Books, Unmasking Autism by Devin Price, The ADHD Advantage, adult clinics offering dual evaluations, and then online communities. Common questions. Is AuDHD a new epidemic? No, we just have better recognition. Can you outgrow it? No, but supports evolve. Will meds help? They help many with ADHD symptoms but work differently with autism. How do I explain it to others? Use the two different operating systems in one brain metaphor. Conclusion and call to action. We've covered a lot today. AuDHD isn't two conditions. It's one unique neurotype with its own challenges and extraordinary strengths. By understanding it, we reduce shame, improve support, and celebrate different brains. If this resonated with you or someone you love, please share the episode, drop your biggest takeaway in the comments, and suggest future topics. Thank you for spending this time learning. You're helping create a more inclusive world. I'm Joseph. Keep celebrating every kind of mind. Take care, and I'll see you in the next episode.